Welcome. Today I will be discussing Chapter 1 from the Blossom Anatomy and Physiology Experience textbook. This is probably for many of you a new experience to be using an online textbook. So I want to point out a few features about the textbook and ways that I think will help you be more successful in navigating and using the book. This book is available to you on your computer, but also works beautifully on a tablet or even on your phone. So I definitely recommend that you get the links, save them to your phone, to your tablet, to your computer, so that you can easily log in. There's also a link found in Blackboard to the site. Recall that in order to access the book, you will need to purchase the code in the MCC bookstore, and by now I hope that you are all doing that. Let's start by going through Chapter 1 today. And when you are watching these videos, please don't feel obligated to watch the entire video in one sitting. You can certainly start and stop, review, make notes. I also posted a quick video that's posted in Blackboard about one way that you may want to do this, and that is using a split screen. So what you can do is you can actually minimize your screen like I'm doing here, and you can put the lecture, the video that you're watching from me, and you can put that on one side of your screen, and then on the other side of your screen you can load your book, right? So you can have your book open. I've got a little video about this, and what that will allow you to do is to follow along in your Blossom version. You can be making notes and notations and highlighting things while watching my video on the same screen or on a different screen. So definitely recommend that you play around and find the best way that works for you. So as we get started, here we are in the Blossom, the chapters are over here. We're going to be talking about Chapter 1, Introduction to the Human Body. And as we look at that, we realize that there are seven sections of this textbook. The last section is just the key terms, basically the glossary for the chapter. Every chapter will start off with key chapter objectives. You can think of these as a study guide. If you were to ask me for a study guide for exam 1, I would likely list out these things. I would say make sure that after reading Chapter 1, you can distinguish between the terms anatomy and physiology. Make sure that you can describe the structures of the body from the most simple to the most complex. And there are 6 levels of organization that you'll be learning about. Make sure that you can identify the characteristics of life. Make sure you know the 4 requirements for human survival. Make sure you understand the term homeostasis and can explain its role in normal human functioning. Make sure you know appropriate anatomical terminology. This is a lot of what you'll be doing in Lab 1, learning about key body structures, body regions, directional terms of the body. And finally, in this chapter, there's a section on different medical imaging techniques like CAT scans, X-rays, and MRIs. And I'll want you to understand the very, very basics of those different imaging techniques. So really, this becomes your study guide, or at least a major idea list. And then each section, this first section is an introduction to the body, and it lists a couple more specific learning objectives that are related just to Section 1. Then Section 2 will have its own more specific learning objectives as we go down. So at the very beginning of the chapter, you have overarching big idea chapter objectives, and then each section of the book has a little bit more granular, detailed learning objectives. Again, this would be an ideal list of things as a study guide for the exam. So here we go. You have signed up for human anatomy. Human anatomy is oftentimes paired with human physiology. The way that we have divided up the courses at MCC is first you'll take Biology 152, Human Anatomy, followed primarily by Human Physiology in 252. In this introductory chapter, however, I will be sort of comparing and contrasting what is anatomy versus what is physiology. So be listening for those differences. So here we go. Anatomy is the study of the body's structures, right? And now, as I highlighted that, I want you to see that you can do the same thing. So as I'm going through this in the video, you can open up your version of the Blossom and you can be highlighting or taking notes along the way. So if I want to capture this definition, anatomy is the scientific study of the body's structures, I can highlight that and I can make it yellow, right, and save that. Or I could come back and click on that again. I can change it to pink or some other color, okay? So you have the ability to highlight, and these highlighted comments will stick in your version. So what you highlight will be there when you open up your text again and each and every time. So anatomy is really learning about the pieces and the parts of the body. The term comes from a Greek word meaning to cut open or to cut apart, right? So we imagine that's what we're going to be doing this semester. You're going to be doing some dissections, and you're going to be opening up a fetal pig. You're going to be opening up a brain and an eyeball and a heart and a kidney, and you're going to be learning about the parts, the pieces, what make up the anatomy of those organs. In anatomy, we talk about a number of different types of anatomy. There's gross anatomy. Now, I happened to highlight that earlier, so as you see, as I opened up my book, what I had highlighted previously is still there for me. So gross anatomy, if you were to go to medical school or go to a PT program, likely one of the first courses you would take in your very first semester would be called gross anatomy. Gross doesn't mean ooey gross, like that's disgusting. Gross means it's what you can see with the naked eye. So gross anatomy, you might also see called macroanatomy, is simply things that you can see with the naked eye, versus microscopic anatomy. And this would be any structure that you need to use a microscope to see, things that are too small for the human eye to see. In lab, we'll be taking a look at cells. We'll also be taking a look at tissues under the microscope. Those would be examples of microscopic anatomy. Specifically, those terms are cytology. Cytology is the study of cells, and histology is the study of tissues. In lab 2, you'll be looking at cells under the microscope, and you'll also be looking at a significant number of different tissues under the microscope, and you'll be learning to differentiate between different types of tissues and what they look like under the microscope. So, as an example, in these two pictures, if you're looking at the whole brain, that's an example of gross anatomy. And if you're looking at cells under the microscope, that would be an example of microscopic anatomy, or specifically in this case, cytology, because we're looking at individual cells found in the brain. There's other ways of studying anatomy as well. There's regional anatomy. Our book is not set up this way, but regional anatomy would be, I'm going to learn everything about, let's say, the shoulder. I'm going to learn everything about the abdomen. So we talk about the shoulder. I'm going to learn about the muscles and the bones and the joint structures, plus the blood vessels and the nerves and the lymphatic structures and everything else that is involved in the shoulder region. Or I might be studying the abdominal region, and I'm going to study not only the muscles, but also the organs found within the abdominal region. So that's one way of organizing anatomy. It's not the way we'll be approaching it, but that's one very common way. Another is systemic anatomy. That's really what we're going to be doing. We're going to be learning our anatomy primarily system by system. We're going to learn about the skeletal system, and in doing so, we'll learn about the 206 bones in the body. And then the next couple of weeks, we'll start learning about the muscular system, and we'll learn, about 80 muscles in the body. Then we'll learn about the nervous system, and we'll learn about the structures of the brain, the spinal cord, the eye, the ear, and name some different nerves in the body. So we will be approaching our course from a systemic anatomical standpoint. The other side of this equation, though, is physiology. So once you learn all the pieces and parts, then you need to learn, what do those pieces and parts do? How do they work together? How do they allow our body to function? So physiology is really about studying the function of the body. What does the body do? What does the heart do? What does the brain do? And those are conversations that I'll touch on this semester, but you will be diving into far greater detail in human physiology next semester. Now, when we talk about how all of this works together, especially from the physiology side, we talk about homeostasis. So the word homeostasis, homeo means similar. Okay, so homeo means similar, and stasis means staying the same, right? Or sort of being static. And the idea is that your body is maintaining homeostasis. It doesn't matter how cold it is outside, right? Your body temperature stays relatively stable. It doesn't matter how, it doesn't matter, for example, if you're, well, let me put it this way. Your body temperature stays pretty stable. Your heart rate stays within a certain range. Your blood sugar levels stay within a certain range. And the way that your body keeps your blood sugar sort of level, keeps your body temperature sort of level, keeps your heart rate relatively level, keeps your respiratory, your breathing rate relatively level, is through this idea of homeostasis. We'll talk more about that in a minute. So I want to hear from you. Name at least 3 reasons why you need to study anatomy and physiology, and specifically what excites you the most about studying this. When you fill this out, push submit, and I will see those responses. Your interaction, your completion of these questions is not optional, my friends. This is part of your participation grade. So make sure that you are stopping to reflect, to think about these questions and are answering these questions. I highly recommend that you do these questions as you are reading through the book. Also, I didn't say this in the beginning, but when you click on this, when you click on these videos and you're learning about, for example, today, chapter 1, I am not going to read this book to you. I am not going to cover absolutely everything in this chapter. I am making the large assumption that you have already read through the chapter and read through it, not maybe in detail, but you've at least oriented yourself. You've looked through the chapter. And then listen to my presentation. I will highlight what's important. I will tell you sometimes things not to worry about, things to delete or to completely ignore. And then if I say something, it's something that you want to take note of. If I say something is unimportant, then you can skip over it altogether. But during these hour-plus lecture discussions that I'm sharing with you right now, I don't have the time to read the entire book. So hear me clearly. These discussions, that's what I'm calling it, a discussion, is not a substitution for your reading the book. Okay? You have got to do this on your own and then come to these, watch these videos as an opportunity to fill in the gaps. Maybe I'll add some understanding. Maybe I'll tell you to delete things, okay? So make sure that you are not just depending upon these presentations. Make sure you are reading the text, because I'm going to be glancing through it, highlighting keywords. You need to read it word for word. Another spot here. What is your future career goal? Give me an example of why studying anatomy and physiology will be important for your career. I really want to hear from you. Okay, so go ahead and give me a sentence or two here about this. Now, a study tip. When you're studying, would you rather read or listen to new material? One of the great things about this textbook is that there are lots and lots of animations. We didn't see one yet, but there are animations, videos that are throughout the text. Make sure you are watching those videos. Take some notes about them. Make sure that you're watching them. Oftentimes the videos are placed before the material is discussed. So it gives you a visual. It gives you something to be imagining as you read. And that has really made a huge difference in students' understanding. At the end of every chapter, there's a place for you to add additional notes. So in addition to your ability to add notes over here, right, you also have the opportunity to add notes down here. And these notes also will be saved if you push submit. So if you want to say, anatomy or physiology. Or another way to use this space would be, I don't quite understand. So maybe you're going to ask a question of your lab instructor or of your SI instructor and say, I'm not sure I really understand regional versus the systemic anatomy, right? The systematic approach to anatomy. So maybe leave a question like that, and then you can go back and you can see that, and you can ask your lab instructor, your SI instructor, or myself about really understanding that a little bit better. So use these places to take notes. At the end, here are 5 questions. You should now be able to, after reading the book, not necessarily after what I've discussed, but after reading the book, you should now be able to answer these questions with confidence. And if you don't get it right, if you don't get it right the first time, it says try again, then you have more opportunities. So go back. If you don't get it right, go back up into the text, find that material, and then come back down and answer those questions. I really want to emphasize doing these questions while you read and while you're learning is really the way they're set up and what will help optimize your learning. Going back and doing these questions later really isn't the intent. So it's really better that you do these questions as you're learning. Down here, there's also some vocabulary checkups that you understand the vocabulary terms. And there's also just a couple fill in the blank. By fill in the blank, it means there's a drop-down menu, and you're just going to pick which of these 2 terms is correct. And then again, check your answer when you're done. So that is the first little section. Pretty quick, isn't it? Let's head on to part 2. Now, in lab, if you've done your pre-lab 1, or at least opened up the pre-lab assignment for lab 1, you know that there are 11 different body systems. And those body systems, we'll talk about those in a minute. And our body is also designed in a hierarchy. So let's take a look at what that means. What it basically says, and our course is set up this way too, is that our body is set up from lesser complex to more complex things. So within our body, we are made up of atoms, and those atoms combine to make molecules. Those molecules combine to make organelles. Those organelles are the building blocks of cells. Cells are the building blocks of tissues. Tissues are the building blocks of organs. Organs make up organ systems. And the 11 body systems or organ systems are what make up you and me, an organism. If we were talking about a biology course, a general biology course, or an environmental science course, we would talk about the biosphere, all of the organisms living within an area, right? So definitely make sure that you're watching these videos. They're short.
Some of the basic levels of organization within the human body include organ system level, such as the cardiovascular system.
So these videos are going to help you with your overall understanding. And then there are absolutely stunning animation or visuals throughout the chapter as well. So here is basically a picture of what we just described. We are made up of atoms. Atoms make molecules like water molecule. Those molecules are the building blocks of organelles and cells. Cells combine to make tissues. Tissues combine to make organs. Organs combine to make organ systems or body systems. And then all of those 11 body systems combine to make you as an organism. So make sure you know these levels of organization. Here is a video to watch. Here's a visual to learn this. And then let's read about it. Okay, so as you read about it, you're going to see a couple of key ideas. Number 1 is that the cell is the smallest independent living thing in your body. Okay, so when we think about this level of organization, atoms and water and organelles, they're not living, right? Cells are the first living thing in this hierarchy. Now, in your body, you have trillions of cells, and each cell is an independent living thing that is working together to create tissues, organs, and organ systems. So the cells are usually surrounded by a membrane. We'll talk a lot about cell biology as we go through this course. Today is just an overview. And within a cell, there are organelles. Organelles include things like the Golgi apparatus, the mitochondria, the plasma membrane, the lysosomes, the endoplasmic reticulum. And we'll be going through all of those organelles in Chapter 3. Those cells are going to combine to make tissues. Tissues, there's a whole bunch of different kinds of tissues, but there's 4 basic types of tissues. I'll go ahead and list them here now, and you'll see this again, especially in lab next week. But there are epithelial tissues, there are connective tissues, there are nervous tissues, and there are muscle tissues. And we'll be looking at a number of these different types of tissues as we go through the semester. Tissues are the building blocks of organs. So if I give you a heart, which is an organ, then the organ is going to be made up of these tissues. And then the heart, for example, is a part of the cardiovascular system. So the cardiovascular system is an organ system. So again, we go back and we think about the video, think about this picture, and answer questions about this hierarchy, and I think you'll very quickly make sense of this. Here's a great fill-in-the-blank activity to make sure you understand the order of these levels of hierarchy. And then, once we understand that our body is made up of these systems, then you're going to recognize these systems. This is going to look a lot like a portion of your pre-lab 1 assignment where you're now being asked to recognize these systems. You don't need to know a lot about these yet. You're going to be learning a lot about the integumentary system when we get to Chapter 5. You're going to be learning a lot about the skeletal system when we get to Chapters 6 and 7. You're going to be learning a lot about the muscular system when we get to Chapters 10 and 11. Okay? Right now, though, what you need to be able to do is when you see one of these images, recognize what system it is. So when you see all the bones, right, that is the skeletal system. When you see all the muscles, that's the muscular system. When you see the heart and the blood vessels throughout the body, that is the cardiovascular system. So make sure you can recognize these systems. Also, for now, make sure you also know 2 additional things. I want you to also know the main organs of these systems. Now, as I ask you to learn these organs, I'm not going to make you list them. So, for example, I'm not going to say to you, list the 8 organs that are part of the endocrine system. But I might have it as a multiple choice question. So I would say to you, which of the following organs is a part of the endocrine system? So you won't have to know all of them, but you will need to know and recognize the different organs that make up the different systems. And then finally, I want you to have a basic understanding, and I mean very basic understanding of what each of these different organ systems is responsible for. Something as simple as the digestive system takes in nutrients and the body absorbs those nutrients. Or the urinary system, the kidneys filter the blood to make urine. Or the male reproductive system, right, which produces sperm. Or the female reproductive system, which nourishes the young and makes eggs. Very basic at this point, but I want you to have a basic understanding of what the body systems do, know a basic idea of what organs are included in those body systems, and first of all, be able to recognize the system when you see it. Again, this looks a lot like the pages 13 through 18 that you're doing in the Green Lab Manual as a part of Lab 1 pre-lab. So read through this, answer these questions. If these questions are giving you difficulty, go back up and review the material until you are successful with these particular questions. Let's move on to section 3. The functions of human life. This is the biology course. And biology means the study of life. So it makes sense that even in an anatomy course, this is also a biology course, that we're going to be learning about the characteristics of life. What does it mean to be alive? And here is the list presented by Blosson. Any biology textbook, I don't care if it's a botany book where you're learning about plants, if it's a microbiology book where you're learning about bacteria and viruses, if it's a cell biology book or a general biology book, or here we are in an anatomy book, you're always in chapter 1 going to be presented with what does it mean to be studying something that is living. So here are the characteristics of all living things. Number 1, all living things are composed of cells. They are well organized, right? So all living things. Now this book is a human anatomy book, so it's going to use human anatomy examples. But this would be true for a flower. This would be true for a whale. This would be true for a frog, right? This is true for any living thing. All living things are organized, made up of cells. Now, some bacteria are only made up of one cell, but they are still highly organized, made up of cells, or we are, quote, multicellular organisms because we have trillions of cells. Each of those cells has its own physiology. Each of those cells has its own structures that is responsible for creating that organization. All living things have a metabolism. Metabolism is basically a fancy word for saying that living things take in energy and use it. Living things take in energy and they use it. You require food to survive. So you ingest or consume or take in food. That food provides your body with energy. And then your body is going to convert that food into fuel. And that energy is going to be then is used to make the proteins and all the other molecules that make up your body. We can break metabolism up into 2 main categories. One is anabolism. Anabolism is basically the process of building things up. And you've all heard this word, right? Anabolic steroids. I think we all know that anabolic steroids are structures or are medications, if you will, that are injected into the body in order to build up muscle. So when you hear the word anabolic, think building up, right? Think about a person who is using anabolic steroids to build up their muscle. And then the other side of metabolism is catabolism. Catabolism. In your vocab list, you're going to see that cat means to break down. So catabolic reactions or catabolism is the process by which your body takes in molecules, breaks them down to gain energy. So metabolism is simply the combination, the sum of all of your anabolic reactions and all of your catabolic reactions. These 2 sides of metabolism are all occurring all of the time. So let's use this figure to make sense of this. This circle represents your body, but this circle could also just simply represent any of the cells in your body. So we take in food of some sort. We take food into our body. Every cell also will take food into it. Those molecules that it takes in, it is going to undergo catabolism. It's going to break down those molecules. Those molecules are going to get broken down into smaller pieces. As those catabolic reactions are occurring, energy is being released. That energy is then going to be used to complete anabolic reactions or do anabolism. Anabolic reactions require energy. So they take the energy that was broken down and released and use that energy to now rebuild molecules that your body needs. So think about it. For breakfast, maybe you had some protein and some carbohydrates. You had some molecules, some food, right? You had some cereal, or maybe you had a protein shake or something. That food was brought into your body. Your digestive system helped to break it down. Those broken down molecules were then absorbed into your cells. And the cells then got energy from those molecules that you ate. That's all your catabolism, your catabolic reactions. And then your cells then use that energy that was released and the building blocks to create new things. So how do you build muscle? Right? You don't eat muscle. Well, we do. We eat meat, but it's broken down into basic parts. We get energy from the meat we eat, and then our body recreates the muscle in our body, recreates the proteins in our body and the enzymes in our body and all of the other structural molecules that our cells need to sustain life. So that's your metabolism, right? Catabolism and anabolism always going on in your cells. The main molecule that is created in catabolic reactions is ATP. So ATP is adenosine triphosphate. You'll hear me say ATP a lot. Basically, that is the molecule of energy. Your entire metabolism is based on the creation of ATP and the using of that ATP in order to build up more complex molecules. What else is true? So all living things are highly organized, made of cells. All living things have a metabolism. All living things are responsive. They respond to their environment. If it's too hot outside, right? If the sun is beating down on you, most of us will seek shade, right? Our body responds to the environment. If it's too cold, we put on a jacket, or our body shivers as a way of creating more heat. If we're hungry, we eat. If we're thirsty, we drink. And your body responds to all of those things. If you have a pebble in your shoe, you take your shoe off and get rid of the pebble because your body's going to respond to that painful stimulus as you step on that pebble. So all living things respond to their environment. All living things have some way of, in that responsiveness of moving, right? Even plants will move toward light. Even bacteria will move toward food sources, right? Animals seek out food, so they move to where they need to be. Cells in your body also, and chemicals and molecules in your body also are able to move, if you will. Okay, all living things develop. They grow. They start off as one form and they develop into other forms. An embryo develops into a fetus develops into a newborn, and the newborn goes through the cycles of life. That is also true of cells. Cells also are formed and then go through a growing phase. They become larger. And in order to reproduce, all living things have the ability of reproducing to create more of the same. So plants make more plants, animals make more animals, humans make more humans, right? So these are all the characteristics of life. Let me just pause here, though, and ask a silly question. It's really not silly, but I want you to think about this a little bit. You go into your refrigerator, you grab an egg, right? You went and bought a dozen eggs. Is that chicken egg alive? Is that chicken egg that you buy at Meijer alive? The egg is a cell. Okay, so it is a cell. It is a chicken egg. An egg is a cell. And if these are the characteristics of life, and earlier I told you that cells are a living thing, that means that cells must also have all of these same characteristics for themselves. So even an epithelial cell, right, grows and develops and reproduces, and an epithelial cell is going to respond to its environment, and it's highly organized, and it has a metabolism. So all living things have the same list of characteristics. So back to that question, is a egg a cell? Well, yes, it's a cell. Is an egg living? And you see, if you start thinking about it, at first you might say yes, then you might think no. We see that it's not so easy, right? Because an egg sitting in your refrigerator doesn't have the ability of growing on itself, right? It can't develop any further. The egg in your refrigerator can't respond to its environment. It can't move toward a higher temperature or a colder temperature. It doesn't really have a metabolism going on. What about a sperm? Is sperm living? It is a cell. And oftentimes when I ask this question, students will say, yeah, an egg is not living because it just sits there, it doesn't move. But a sperm, man, it's living because it wiggles, it moves. But think about it, a sperm on its own, right, is not capable of reproducing. A sperm is capable of movement, and it does respond to its environment. But what we see here in this example is that egg and sperm, yes, they're cells. Yes, they're considered living, but we see that the egg and sperm don't complete all of the requirements of living, do they? So the list of things required for life is not as straightforward, right, as it would appear as you read through a book like this. Again, quiz at the end, answer these questions, a little vocabulary terms here to help you as well. Moving on. So those are the functions of life. What are the requirements for human life? So this is a pretty straightforward list. We need oxygen, right? We need oxygen. Our air is about 20% oxygen. Most of our air actually is nitrogen gas, but about 20% of our air is oxygen, and we absolutely must have oxygen. All of our cells need oxygen, and this is why brain damage or heart attacks are so devastating. If there's just a few minutes where the cells of the heart in a heart attack or the cells of the brain don't have oxygen, then permanent damage happens, right? So a brain that doesn't get blood or oxygen is having a stroke. A heart that isn't getting oxygen or blood is having a heart attack, and those are devastating to those organs. All living cells and things, we need nutrients, right? We need to take in food and get energy from that. When you look at your food label, just pick up anything near you, or tomorrow when you're eating some cereal, take a look at your food labels, and it tells us how many grams of carbohydrates we're eating, how many grams of proteins we're eating, how many grams of lipids or fats that we're eating. Those are all necessary components in our diet. We need those components in our diet to have a well-rounded diet. Okay? So those are the molecules that are energizing our body and are providing the necessary molecules for metabolism to occur, right? For the anabolic and catabolic reactions in our body. Again, watch these videos. In addition to those macromolecules like fats and proteins and carbohydrates, our body also requires vitamins and minerals. Take a look at your vitamin bottle, right? I hope you're all taking a vitamin every day, and that vitamin has things like copper and magnesium and manganese and iodine and iron, and it'll have B vitamins and vitamin D and vitamin E and vitamin A. Our body also needs vitamins and minerals to survive. Our body needs to stay within a relatively narrow range of temperature. Now, we can go out into a very cold environment, but we're warm-blooded animals, and so our body works really hard to keep our body temperature about the same. Body temperature is, you've probably heard this number, about 98.6 degrees Fahrenheit or 37 degrees Celsius. Man, during COVID, right, we've gotten used to having our body temperature taken. And so you know that your body temperature stays relatively the same. If you have a high body temperature, you likely have a fever, you have some sort of infection going on. If you have a low body temperature, you have hypothermia. Perhaps you've been outside for quite some time in a very cold environment, and our body does not work well in those high and low temperatures. So for normal metabolism and for normal life, we need to keep our body within a relatively narrow range of temperature. and our body will sweat, right, to give off heat when we're overheated, and our body will shiver to create heat when we are cold. And then finally, the last thing is pressure. And this is something we don't think about too much, but on the Earth's surface, we are surrounded by an atmospheric pressure. This is the pressure of, well, I'm redundant, but it's the pressure of the atmosphere on our body. We don't think about it because we were born in this atmosphere. But as we are in our everyday environment, we're surrounded by the atmosphere, by the gases in the environment. And if our atmospheric pressure is vastly different, then we cannot get the oxygen out of the air as is needed. This is why divers have issues when they go down into deep water and return too quickly. Those pressures are problematic for them. Or this is why if you're climbing up a high mountain, you need to be very careful in how fast you ascend up the mountain, because the atmospheric pressure is changing, and that makes life more difficult or even impossible if you are at a too high or too low a pressure. So those are the characteristics of human life: oxygen, nutrients, temperature, and pressure. And that is the end of this little section. Now, throughout the book, you'll see these little homeostatic imbalance stories. These are great little stories. They're going to help you better appreciate, sort of apply what you're learning. These are self-standing little sections, not terribly difficult to understand, but highly recommend. When you get to a box like this, don't just jump it, don't just skip it, read it, because it's going to help further your understanding of why you just read what you read. Read through the quick review. Ask yourself, what do I not understand? What questions do I have? What do I need to hear again? What do I need to go back and review again? And then answer those questions. And come to SI, go to lab, and ask these questions. Or set up an appointment with me to discuss these things. Moving on to section 5. This is about homeostasis. I've already introduced this topic. So homeostasis, one way of thinking about it is, again, no matter how varied your external environment is, no matter how hot it is outside, your body temperature is going to stay relatively the same. No matter what you're eating, your blood sugar is going to stay relatively the same. Now, it's going to fluctuate up and down, but it's going to stay within a normal range. Your blood sodium levels, your blood calcium levels, your blood chloride levels, your oxygen levels, right, in your blood, all of those things are going to stay relatively the same. That place where they normally stay is called the set point. And I'm going to use an example of a thermostat in your home, right? We all have a heater in the winter, and some of us have air conditioning in the summer, and we know how this works. We go to our thermostat and we set it, let's say it's winter, and we're going to set the thermostat at 70 degrees. 70 degrees. Well, let me ask you, does the temperature in your house during the winter stay at 70 degrees when you set the thermostat to 70? And the answer is no, right? It is going to go up and down. There's going to be a variation, right? You're going to see your temperature go up, and then it's going to come down. It's going to go up, and then it's going to come down. But it's going to hover around that 70 degree point. That is the set point. And your body has a set point for all of the things that I'm talking about. Body temperature, right? 98.6, and other physiological parameters. There's always a set point. And there's a range that your body will keep those values within. If your body is able to keep your blood sugar within a normal range, then that's good. If your body keeps its body temperature in a normal range, that's good. If your body keeps your heart rate in a normal range, that's good. But what if your body cannot maintain this normal range? If your body cannot maintain its normal range, you're going to see a doctor, aren't you? If you can't maintain your blood sugar, if your blood sugar is too high, you might have a disease called diabetes. If your blood sugar is too low, you might have what's called hypoglycemia. If your body temperature is too high, you might be ill. If your heart rate is too high, if your blood pressure is too high, you might have hypertension, right? High blood pressure. Or you might suffer from a low blood pressure, which makes it hard for your brain and other organs to get enough blood sometimes. So you see the idea. Our body has a set point, tries to keep these things within the normal range, and when it can't, we have a disease. We have something that our body needs some extra help on. Now, how does the body maintain homeostasis? The main idea, and this is a weird word, but the main term, how the body maintains homeostasis, is this thing called negative feedback. Negative feedback is the mechanism by which your body reverses a deviation. So let's go back and talk about the thermostat for a second, okay? And we've got a sensor. So let's use the thermostat for a moment. In your home, you have a sensor. That's the thermostat. You have it set to 70 degrees. That's also the receptor, because your thermostat is receiving, it's measuring the temperature of the air in your home. And so it is sensing the air temperature, and it's a receptor for that. Now, what's going to happen when the temperature, your heat's come on, right? And the temperature is going to rise a little bit. You've got your thermostat set at 70, but it's not going to turn off at 70. Your home's going to heat up to like 71 degrees. At that point, the heater is going to turn off. Okay. And now once the heater turns off, what's going to happen? Because we have leaky windows and leaky doors and our insulation's not perfect, the temperature in the house is going to start dropping down. It's going to drop down from 71. It's going to drop down to 70. It's going to drop down to maybe 69 degrees. At that point, the thermostat, the sensor, notices that the temperature has dropped. And what will happen? The heat will come back on, won't it? So, as the temperature was too high, right, as you warmed up your house, the thermostat turned off the heater. And then as the temperature got too cool, the thermostat turned the heater on. Those are actions of negative feedback. Let's look at that word again. Negative feedback is a mechanism that reverses a deviation. So as the temperature gets too high or as the temperature gets too low, the heater either turns on or the heater turns off. Same thing is true in your body, right? Your body temperature, if it exceeds 37 degrees, right? Your brain and your skin are going to sort of be measuring that temperature. And if it starts to get too high, then your brain is going to send signals to your body that says, hey, sweat glands, start sweating. And that sweat is going to then feed back, right, and help cool off your body. Or if it's too cold, your body might start to shiver, right? And the shivering would then increase your body temperature. But you see that there's something that happens. When something happens, we call that an effector, right? The effector is whatever has an effect. It's going to, your body's going to shiver or your body's going to sweat. Your sweat glands would be an effector. Your muscles in your skin that cause you to shiver would be the effector as well. So most of our homeostasis is maintained by a negative feedback loop. There's a few other examples provided here about this. One is about blood sugar. One is about your blood sugar levels. And this little video also talks about thermoregulation and how negative feedback is involved with thermoregulation. So definitely read through these examples and then watch the video as well. Answer the questions. Now, if there is a negative feedback, there's also going to be a positive feedback. You'll be seeing in anatomy for everything there was the opposite almost always. So positive feedback is a very different phenomenon, I think, than what it actually is. And by that, there aren't that many examples of positive feedback. Let me give you a couple of them. Childbirth is one example of positive feedback. positive feedback says that as something changes, it actually intensifies the change. The body cannot reverse it. So when something that has a positive feedback system is involved, as it begins, it continues. It doesn't get knocked back down. So unlike the temperature in your house or your body temperature, as the temperature goes up, right, it gets knocked back down. As the temperature gets too low, it gets pushed back up. In positive feedback, when something starts to go off, it continues until it's done. So in childbirth, if you know a person who's had a baby, maybe they went into premature labor, right? Once the uterus begins to contract, it's very difficult to get it to stop. Once childbirth begins, once the uterus begins to contract, there actually is a positive feedback loop that occurs, and hormones begin to get released, and the birth of the child will occur. There's really no way for the woman's body to stop childbirth once it begins. Now, if a woman goes into early labor, what can we do? The body has no way of stopping it, but the woman can go to the hospital. We can give her some medications, some bed rest. We can do some things to help slow down or stall the childbirth if it's a premature labor, but the body itself has no way of doing it. Okay, so here's an example of positive feedback whereby childbirth, right, once it starts, it goes until it completes. The body does not have its own mechanism to stop labor. So this video goes through a nice example. Another example of positive feedback is blood clotting. Once blood begins to clot, it finishes the process until the blood clot is complete. Okay? The body doesn't really have a way easily of stopping blood clotting once it begins. We'll talk a lot about blood clotting later on in the course when we get to the cardiovascular system. So we've talked about homeostasis and the fact that the body uses positive feedback and negative feedback to maintain homeostasis, but to be honest, mostly negative feedback. Okay, positive feedback, very few examples of this, and not something your body uses every day. Mostly your homeostasis is maintained by negative feedback mechanisms. The next section, 1.6, this is going to feel a lot of repeat from your lab 1. So I am going to go through this, point out the most important things in lab. You'll be breaking this down into significant more detail. Okay. Anatomic position. Imagine. Also, you'll also be hearing many of these same themes and ideas in the pre-lab 1 video. So make sure that as you prepare to attend lab 1, that you watch the pre-lab 1 video that's posted in the lab 1 folder. Anatomic position is a standard way for you and me to discuss anatomy. Okay, it's an absolute necessary standard. Anatomic position is as follows. The person is standing up. They've got their feet flat on the ground. Their head is looking, their eyes are looking forward. Their arms are down to the side. Now there's one thing that your lab manual is going to say about anatomic position that is not included here. And I want you to figure that out, okay? It's very easy, but read through what anatomic position is and tell me what is it that is not correct in this diagram. In fact, that question is asked down here. What is not correct, or what aspect of anatomic position is not accurately shown in this figure up here? Okay. Throughout the body, there are regional names, right? There's a name for everything on the body. Some of these terms are probably very familiar to you, but I'm also going to guess, let me make this larger, some of these words are not familiar to you. So for example, if I said to you, point to your abdominal region, right? Your abdominal region, most of you would have no trouble pointing to basically your, the stomach region, right? That would not be a problem. If I said point to your umbilical region, right, that's your belly button, that probably would not be a challenge. If I said to you, point to your frontal region, however, you may not know that the frontal region is your forehead. Okay, so some of these terms are familiar, some of these terms are not going to be familiar. You need to learn all of them. So in the lab, you'll be working through some worksheets and some activities, and you definitely want to focus on the ones that you're not familiar with. I could spend 20 minutes just on this diagram going through this. What's important, though, is that when you get to lab, you really break this down and you learn these different regions. Practice this, my friends. Get in front of a mirror and practice this. Practice this with lab partners or in SI. Of course, have permission before you start poking on somebody's body, but walk through these regions. The cervical region is your neck. The nasal region is the nose. The otic region is your ear. The ocular region is your eye. Okay? Cephalic is your entire head. Oral region is your mouth. And your mental region, this one may not be familiar to you, is your chin. Okay, that one is not very familiar for a lot of students. If I say to you, where's your axillary region? That's your armpit. Your brachial region is your upper arm. The antebrachial region is your forearm. Okay, so most people might guess about the brachial region, but they're not very clear about the antebrachial region being the forearm region. So you get the idea. It's very important that you know these regions. Okay, let me point out one that's not very common. The crural region, that is the front of your leg, or you might call that your shin. And then if you go down and you look on the posterior view, the back side of the body, you'll see that this, clicked on the wrong one. I'm not able to click on the lower one. The sural region is your back of your lower leg, your calf. Okay, so sural is the back, crural is the front, your shin region. So definitely learn your regional terms. Okay, another thing you'll be learning in lab is prone versus supine. Prone is when a person is lying, when they're lying down and they're face down, that is prone. Supine, they're laying face up. So you're laying in bed, right, and you're watching TV. You could say that you're supine. And if you are face down into the pillow, then you are prone. Okay, those are also terms. You're going to be learning a lot of anatomical directional terms in lab this week as well. So let's talk about some of those directional terms. All of these directional terms come with pairs. And when you use one term, it's appropriate to use the matching term. So, anterior and posterior. Anterior is toward the front. Posterior is toward the back. So up here, right, this is an anterior view. We're looking at the front of the body. This would be a posterior view of the body. Another pair of terms that mean the same thing for humans: ventral and dorsal. Ventral means toward the belly, toward the front. Dorsal, think dorsal fin on a shark, toward the back. So you could also say that this is a ventral view and that this is a dorsal view, although you'll hear and see anterior and posterior more commonly. Superior and inferior. Superior and inferior. Superior toward the top, inferior toward the bottom. Now this can refer to the entire body, or this could refer to just a heart. If I give you a heart or a brain, we could talk about superior or inferior. Other terms that mean similar would be cranial and caudal. Cranial toward the head, caudal toward the tail, toward the backside. Lateral and medial. Lateral to the outside of the body, medial to the inside, to the median, to the middle. Proximal and distal. These are the two terms that give students the most trouble the first week or so of classes. Proximal means closer to the point of attachment. I'll show you the picture in a second. Distal, further away from the point of attachment. Let's look at this image. When you're using these two words, proximal and distal, we're only going to use these words to describe the arm and the leg, the upper limb and the lower limbs. Proximal, where your arm attaches to the body, near the shoulder, that would be proximal. Further down toward the wrist, that is distal. In the leg, right, in the lower limb, proximal is up by the hip and distal is down by the ankle. You are not going to use superior and inferior when describing relationships between structures on the arms or the legs, or another way of saying it, on the appendages. Medial toward the middle, lateral to the outside. Notice our person is primarily, not completely, but primarily in anatomic position when demonstrating this. The last two terms are superficial and deep. Superficial, closer to the surface of the body. Typically superficial and deep in our course, we'll be describing things toward the surface. So the skin is very superficial. A cut, a wound would be very superficial if it's on the outside. And then a deep wound or a deeper thing. So the skin is superficial, the muscles are deep to the the muscles are deep to the skin. Flip it around, the skin is superficial to the muscles. Another thing you'll be dealing with in lab is looking at body planes. If you've ever had a CAT scan or an MRI, you know that you can see different planes within those imaging techniques. And there are three main primary planes that you'll be seeing a lot of this semester. Number one is sagittal plane. The sagittal plane basically divides the body or an organ into left and right sides. Now, these two sides do not have to be identical, right? So if you divide something, it doesn't matter if it's over here, right? And you're cutting basically the arm off, the right arm off, or if it's right down the middle, it's still sagittal. Now, if it's right down the middle of the body, as I'm using with my pointer, if it's right down the perfect middle of the body, that sagittal plane has a special name called mid-sagittal. Okay, mid-sagittal, but most sagittal cuts are not equal, and if they're not equal, we're going to refer to them as parasagittal planes, or simply sagittal. Again, don't forget to watch these videos. Another plane is the frontal plane. The frontal plane has another name. It's also called the coronal plane. So you might want to highlight that frontal plane. Right, frontal plane is the same as coronal plane, and highlight that so that you know that those are the same. A frontal or coronal plane is going to create front and back sections, anterior and posterior sections. And then finally, there is the transverse plane. The transverse plane has two other names. It's also called the horizontal plane. It's also called cross section. And in a transverse or horizontal or cross section, you're producing upper and lower portions, superior and inferior portions. So here's a great little image. There's something like this in your green lab manual as well. And you can see that in this person, she is standing in anatomic position. If you slice her into upper and lower portions, any of these slices would be a transverse, horizontal, or cross section. It could be up here, it could be here, it could be cutting across at her ankles. The section that is providing left and right sections is called sagittal. If it's right down the middle, you could call it mid-sagittal. And then the frontal or the coronal section is the one providing front and back portions of the body. So that is how to name structures on the outside of the body. That is how to imagine slicing through the body. Let's now slice into the body and see what we see. So here we're looking at the body from the side. This is a lateral view. What section was used to create this lateral view? Think about it. What sort of section was used to create this lateral view? And I hope you thought to yourself, that would be a sagittal slice, right? You cut the body into a left and right side, and we're looking into the body from the side. Here we're looking at the body in an anterior view. What plane of section was used to create an anterior view? And I hope you answered frontal or coronal. It slices off the front so that you can see within the body from the front, from the anterior view. This would also be called the ventral view. So as we do that, let's take a look at what we see. Inside the body, there are some cavities. The cranial cavity here is where the brain is held, and continuous with the cranial cavity is the vertebral canal. When you look at the cranial cavity and the vertebral canal from the side like this, you can see that these two body cavities are in the back side. They're on the dorsal side of the body. So they're considered dorsal body cavities. If instead we look at the thoracic cavity, this is the home of the heart and the lungs, and we look at the abdominal cavity, and we look at the pelvic cavity, these three cavities are toward the front of the body. So these three body cavities are considered ventral body cavities. Now, the abdominal cavity and the pelvic cavity are really not separated by anything. They're continuous. And so some books, including ours and our lab manual, will not only talk about the abdominal cavity and the pelvic cavity, but we'll talk about the combined abdominal pelvic cavity, just combine the two sections into one big area. The thoracic cavity up here is separated from the lower abdominal cavity by a muscle called the diaphragm. So there is a separator here between the thoracic and the abdominal pelvic cavities. Within the thoracic cavity, you can see this is the home of the heart. This is the home of the two lungs. And this is also home of a region referred to, shown in yellow, referred to as the mediastinum. Mediastinum. Think of it almost as in the middle behind the sternum. Sternum. Sternum is your breastbone. It's the bone that's been removed here, but it would be sitting right where I'm showing the arrow. So think of the mediastinum as the area sort of behind or the middle around the sternum. You'll be labeling these activities or these areas in lab as well this week. Now, if you go to the doctor and you say, hey doc, I'm having some pain in my abdominal pelvic region, they might have you point to it. And at first, they might say, okay, where does it hurt? And you might point to your upper quadrant, your upper abdominal pelvic quadrant. I want you to see something. Basically, if you draw a big plus sign, your umbilical cord, your umbilicus is right behind the crossover spot, right? Notice that the right side over here is the right side for the individual that you're looking at. So this is the patient's right side. This is the patient's left side. So everything over here is left. Everything over here is right. It will take you a little while to get accustomed to flipping the left and right on models and on images, but it's a very important thing for you to make sure you're getting correct. So you might say to your doctor, hey, something is hurting in my upper right quadrant. That's fine. But a more specific way of pointing out where something hurts is, instead of a big plus sign, putting a tic-tac-toe board across the abdominal pelvic region. And each of these 9 regions has a name. These 9 regions were described to you in the pre-lab video. I'll mention them very, very quickly. In the very center of your tic-tac-toe board, this is the umbilical region. If we go superior to the umbilical region, you are in the epigastric region. What you can't see in this particular diagram is that the stomach is right about here where I'm drawing my pointer. So you're kind of on top of the stomach in the epigastric region. And then below or inferior to the umbilical region, you're in the hypogastric region. Hypo meaning below or under. So underneath all the digestive organs, you have the hypogastric region. This is also commonly called the pubic region. Now, if we go, this would be the middle, right? These are medial sections. If we go lateral, let's go to the outside. Lateral to the umbilical region, you have the left and right lumbar regions, right? Left and right lumbar regions. Some books will also call that flanks. Let me make it larger. This is also called your flank regions in some books, okay? If we go lateral to the epigastric region, you're in the left and right hypochondriac region. Left and right hypochondriac region. Hypo under, chondro ribs. So you're kind of like right up underneath the rib cage when you're in the left and right hypochondriac regions. And then if we go to the bottom, go inferiorly, below or inferior to the lumbar regions, you have the inguinal region. The inguinal regions, left and right inguinal regions. So those 9 regions of the abdominal pelvic cavity, that big tic-tac-toe board, do make sure that you know those 9 regions. One more thing to introduce in this chapter. This is something you're going to be hearing about over and over and over and over this semester, and that is the serous membranes. There are 3 serous membranes in your body. There is a serous membrane that goes around your heart. There's a serous membrane that goes around your lungs, and there's a serous membrane that goes around your abdominal organs. So let's start off with the first one. This is the one that goes around your heart, okay? The one that goes around your heart is called the pericardium. The pericardium, or the pericardial sac that surrounds the heart. The video describes this to you, as does this picture. Imagine you're taking your fist and punching it into a balloon. As you push your fist into the balloon, right, you make this huge indentation, and now there's 2 layers, if you will, of that balloon, right? There's a layer that's right up against your fist. That is called the visceral layer. Viscera means the organ. So the visceral layer is up against the hand or the organ. The outer layer of the balloon is your parietal layer. Parietal means wall. So it is surrounding the outer wall of this membrane. And then in between, in the balloon, there's an air space. Well, around your heart, there's a space, but this space is the pericardial cavity, and it's filled with some watery solution. And that fluid is there to help moisten and also to reduce friction. Remember, your heart is beating 60, 70, 80 times a minute. And if it weren't for this fluid, the heart would build up some heat and would also cause some friction, which could be damaging to the organ. This fluid also allows your heart to work independently and not rub up against the neighboring lungs and other tissue around the heart. So here around the heart, we have the pericardium. It is made up of 2 membranes. That is the visceral layer on the inside. I always say that it's shrink wrapped to the organ, and the parietal layer on the outside. That's the example for the heart. Around the lungs, there is a similar serous membrane. It is called the pleura. It's the same idea. It surrounds the lungs. And then around your abdominal organs, think your stomach and some of your other, like your intestines, you have the peritoneum. The peritoneum. So these are all 3 terms that start with the letter P. The pericardium, the pleura, and the peritoneum. They all have 2 layers. There's the parietal layer, that is the outer wall, and there's the visceral layer, which is the inside layer, which is shrink wrapped to the surface of the organ itself. Again, these concepts are also covered in the lab manual quite well. They're also covered in the pre-lab video, and you'll be hearing about them quite a bit over the coming weeks. Make sure you answer these questions. And there's even some labeling activities down here to make sure you understand. So label 1, 2, 3, and 4. These are drop-down menus. Here are the 9 regions of the abdominal pelvic cavity. Again, a drop-down menu, 1 through 9. There's some labeling activities for your body directions. So make sure you do these activities, naming different regions of the body. Again, drop-down menus. Okay. So do all of these questions as helps to not only the lecture, but also the lab. The last little bit we have is in section 7. And section 7 is about medical imaging. Many of you are going into health fields where you'll be looking at x-rays, MRIs, CT scans, ultrasounds. You might even be looking at PET scans. And these are common imaging techniques. Some of you might even be going into imaging, going off to get your x-ray technology or MRI certifications. So I want you to learn the basic ideas. So in here, let me show you an idea that I'm going to be using throughout this semester. When it comes to x-rays and it comes to some of these other things, here's what I want you to know. I do not care about the person who invented it, right? I'm not going to ask you to know the years of his life, okay? So I am going to, from this point on, whenever there's something that I don't care about or I don't want you to worry about, I'm going to use blue. So I am going to click that. I'm going to highlight it as blue. I'm going to save it. So whenever you see blue, you know that it's something you don't need to know. Up until now, I haven't made any blue moments, right? So up until now, everything you need to know. But I am not going to worry about, for example, the fact that in 1901, right, they were given the Nobel Prize. Those are not the sort of facts that I care about. Okay, what I do want you to know is that x-rays, right, important, let's call it yellow, x-rays use energy. They're using x-rays or a very high energy electromagnetic radiation. And those signals, right, that energy radiates, it goes through solids and gives us a negative image. So when you look at an x-ray, you see the negative image. You see the bone, right? The bone is a solid and you see that. You can see here the bone to the wrist and the bone to the hand as well. We probably all had an x-ray. The problem with x-rays is that one bone can block another bone. So if you go to the dentist and you have an x-ray, or you go to the hospital and you've broken a bone, the disadvantage of radiation, 2 reasons. One is that one bone will block another bone behind it. The other problem is that having excessive radiation exposure to x-rays is problematic. And so you want to minimize the number of x-rays that you are exposed to. And those who work in medical fields are always measuring and are careful about their x-ray radiation exposure. Another technique that you'll see a lot of are CT scans, okay? Computed tomography. And what it's telling you is that a computer is necessary to collect CT scans. Basically, you're using the same energy, right? You're using the same x-rays that were used in normal x-rays. But with the help of the computer, you are creating slices, right? The computer is creating topographic maps of the body. The great thing about CT scans is that things don't get blocked. So you go underneath the CT scanner, and the great thing about it is that you are able to see one bone behind another bone. CT scans are also great for looking for solid tumors. So CT scans are used sometimes to see cancers, solid tumor cancers. Okay. MRIs. Again, this is just a very brief overview. MRIs. MRIs do not use X-rays. Instead, they're using magnets. That's why they're called MRIs. MRI magnetic. Okay? And if you've ever had an MRI, you know that MRIs are always done in away places, either in a separate building or down in basements. And there's very, very, very strong magnets. If you have implants that are magnetic, you can't have an MRI. And so they always ask you, do you have any implants? Do you have anything in your body that could be drawn to these very, very powerful magnets? They will rip out things out of your body. These magnets are super, super strong. What's happening is that these magnets are realigning the atomic structures in your tissues. What's great about MRIs is that they are great for soft tissue. So X-rays and CT scans are better for solid structures like masses, tumors, and bones. MRIs are great for looking at soft tissue, looking at cartilage, looking at fluid-filled regions of the body. And that's where an MRI is fantastic. They also have very, very high resolution. Again, watch the video and appreciate how MRIs are different from CAT scans or X-rays. Two more, friends. Two more. Next, it's PET scans. Nothing to do with animals and ponies, right? But PET scans are going to use radiation. So in a PET scan, an individual is going to be given some radiation. That radiation is going to permeate throughout the body. Now, oftentimes it's radioactive glucose. Now, glucose is sugar. It's the most common energy source, and sugar is taken up by all of the cells in your body. So a person takes, they give them some radioactive glucose. The glucose is taken up by all of the cells of the body rather quickly, and then they do the PET scan. Now, cells in the body that are rapidly growing are going to pick up more of the radioactive glucose and are going to show up as a, quote, hot spot in the PET scan. So what sort of tissues are rapidly growing? And the answer is cancer, right? Cancer tumors are rapidly growing. So oftentimes PET scans are used to show rapidly growing tumors. And on the PET scan, there will be a hot spot, right? And the video will describe that to you. There'll be a hot spot. Now, PET scans can also be used to see cold spots. I want you to imagine a person has had a heart attack or a person has had a stroke. A part of the heart muscle has died. A part of the brain has died in that stroke. They introduce the radioactive glucose. They wait a few minutes. They do the PET scan. The part of the heart that has died is going to not take up the glucose and will appear as a cold spot in the PET scan. And the part of the brain that has died from the stroke will show up as a cold spot. So PET scans to be shown to show overly active, growing, fast-growing cells like in a tumor, or PET scans can be used to show slow-growing or dead regions of the body within an organ by showing cold spots. Again, radiation is the energy that is used. And the last technique that I want you to be just basically familiar with is ultrasounds or sonography. And here, the energy being used is high-frequency sound waves. This is the same technology used by the Navy to use sonography to see sunken ships or to see large animals under the water. Same idea, we can use high-frequency sound waves to see. We can see kidneys, we can see organs, we can look at stomach issues, but more commonly what you're probably more familiar with is we can use ultrasounds to study fetal development. So using an ultrasound, we can take a look at the fetus and we can look for any problems, look for growth, making sure everything is normal as far as skeletal and other organ development. So ultrasounds are very, very commonly done during pregnancy. The great thing about them is that they are not going to damage the baby. Okay, so ultrasound uses sound waves, and there's a little video here about that. And then here's some examples down here as well. and read through these examples, read through the images here. Here's a PET scan, and you're seeing hot spots in the PET scan, right? You can see the lit up areas, indicating that there's faster growing cells in those regions. Here we see a typical ultrasound, and you can see the part of the body of the baby. So that brings us to the end of 1.7 and to the end of chapter 1. Again, make sure that you are reading the entire book, highlighting these things. As we go into new chapters, there'll be entire sections that I'll tell you not to worry about. Chapter 1, though, is a chapter where almost everything is very, very important. You will be hearing a lot about this also in Lab 1. Moving forward, we are not discussing Chapter 2. So the next lecture that I post will be about Chapter 3, about cellular structures and cellular processes. The chemistry section of this book is not going to be covered in the lecture. There will be a few topics from pre-lab or from Lab A, the asynchronous lab, that you may want to look at a few things here in Chapter 2, but there will not be anything particularly heavy covered from Chapter 2. You might want to look through it as a review of some things, but if you haven't had high school chemistry or college chemistry, don't worry about it. We're going to be jumping from Chapter 1, jumping into Chapter 3. That brings us to the end of this presentation. See you next time.